Let's discuss about some MCQs of biology. MCQs number A. A 3-day of old term infant with a hemolytic disease of a newborn due to RH incompletely has a serum indirect bilirubin concentration of 33 mg. You perform an exchange transfusion with no further elevations of bilirubin have 19 mg. Among the following, the most appropriate study to use a follow-up on the infant is another COMS test, brainstem auditory evoked response, computed terminology of the head, hemoglobin electrophoresis, indirect retinoscopy. They all breastfeed infant born at a term has been decreased appetite, irritability, and a volume for 24 hours. On a physical examination, the infant appears listless, respiratory rate 40 minute, heart rate 60 minute, and blood pressure 68 over 388 mg. The skin and the sclera are atrophic, but no other abnormalities noted. Laboratory studies reveals hemoglobin, bacterial CPs, blood group incompatibility, breast milk jaundice, hypothyroidism, intrauterine infections. A 3-year-old breastfeed infant developed jaundice. The serum bilirubin level is 12 mg with a direct bilirubin components of 0.5 mgl. The infant mother asked whether the jaundice might be associated with breastfeeding, which a following statement regarding hyperbilirubinemia associated with the breastfeeding is true. Direct hyperbilirubinemia associated with the breastfeeding may occur as early as the first day of life. Water supplementation in a breastfed infants will significantly reduce the serum's concentrations of indirect bilirubins. Hyperbilirubinemia associated with the breastfeeding may persist for 8 to 12 weeks. Decrease the clearance of bilirubins may play a role. Gyna breastfeeding jaundice, breast milk jaundice. Of the following condition, which is the most consistent finding of milk cholestasis without the evidence of biliary atresia, lead intoxications, chronic hemolytic disease, alpha antitransplantations, breast milk jaundice, and Krieger-Nadger syndromes. A 4-week-old breastfed body has milk jaundice since birth. Weight gain has been poor. The urine is a light blood brown and the stools are pale yellow-green in color. At the point, the most appropriate next step in a management is observe the child clinically for a 2 to 4 weeks, stop breastfeeding and re-examine the child to 7 to 10 days. Obtain a cycloecosystems, obtain a total indirect human bilirubin levels and studies of liver function. You are presenting to the 5-year medical students on integral jaundice. His statement is true. Is normally excreted in a urines following the conjugation to a glycolic acid, achieve a high blood levels due to hemolysis associated with the glucose 6-phosphate dehydrogenase deficiency must be prevented from reaching a 34 volume ml in a well-term babies by use of exchange transfusions if necessary. Result from the oxidations of hemoglobin by the enzymes of gluconeotransferase. Neonatal jaundice associated with all of following sect: prematuri, citrus fibrosis, Gilbert syndromes, breast milk filling, neonatal thyrotoxis. A term baby is found to have a serum bilirubin of 250 at 18 hours of age, which following is true. Physiological jaundice are most likely case. An urgent conjugated bilirubin level is indicated. It is unlikely to be due to hemolysis. The infant blood group and COMS tests are the most important investigation. There is no indication to start phototherapy. A term baby is found to have a serum bilirubin of 250 at 18 hours of age, which following is